So I'm going to change slightly the topic. Of course, we are within the usefulness of MS-39, but I'm going to try to skip from regular topographies to show something else that is going to prove the versatility of the device. So this is a case, all are real cases from the day-to-day practice. The 2-year-old case where patient came for a routine follow-up for pre-op of cataract surgery. This is the picture. And so, before we didn't have any chance to look at this, we saw something rare and we said, okay, I'm gonna just have a follow-up. But now, thanks to the high-resolution OCT, as the MS-39 does, you can do a high-resolution OCT and then confirm the diagnosis that this ocular surface squamous carcinoma in this patient. Because then we can see the pathognomonic 3 signs that Carol Karpin, Bascom Palmer described many years ago, that we'll see later. So with just one scan, you can diagnose cancer on a patient and then treat it conservatively, because that will not require surgery. And with an anamorphic image that you're going to have a higher resolution, you can see perfectly the 3 signs that are hyperreflective epithelium, thickened with an outward transition shown between normal and abnormal. You can see perfectly, follow the normal epithelium and see how it transforms and then into a dysplastic neoplasia there. So is ocular surface squamous neoplasia. As I said, this was described many years ago, but with a prototype of high-resolution OCT that is not available for any of us. But now, hopefully, we have devices like the MS-39 that allow us to do such scans and do the diagnosis of this disease with just one scan in 1 minute, and then skip. Like the patient, okay, I'm going to see you in 6 months, and then it might progress or not. You can diagnose it on stage. So, and also this is critical because now it is not necessary to do surgery on these cases because we have the topical chemotherapy that allows to treat the patient and heal the patient without the need of even a biopsy, not a surgery, anything, just drops. And the thing is that to have devices like the MS-39 is critical, not only for the diagnosis, but also for the follow-up, because we need to monitor the response to the treatment, we need to monitor the resolution of the disease, and we need to monitor in the long term if there is any recurrence of the lesion. This is another case. Here is more obvious. Okay, this actually was a case that was seen for cataract surgery in another place, and actually they bought the patient and they didn't pay attention. They thought that it was a regular panus, although here the diagnosis you would agree that is more clear. And again, on the MS-39 you can see the 3 signs of hyperreflective thickened epithelium with an outward transition shown. And actually here with the epithelial maps, you can see the thickening of the epithelium sectorial on the area of the lesion. And here you can see the 3 signs, as I said, thickened epithelium, hyperreflective epithelium with an outward transition zone. This very beautifully seen with an anamorphic image provided by the MS-39. This patient, she was 92. Of course, I was not going to do any surgery. With no biopsy, no surgery, the patient was healed. Interferon alpha 2b that unfortunately now we don't have available after the pandemic, but 4 times a day for 4 months, patient healed. And as I said, with the MS-39, you can monitor the response. You can see how you have a beautiful, perfect, homogeneous epithelium with a normalization of the epithelial map thickness and an anamorphic image. You can see perfectly how the patient is healed. I'm pleased. And this is the final case I'm bringing to you. This is what looks like just a pinguiculitis. And actually, this patient had bilateral pinguiculas on the nasal and temporal sector, and the patient just came for a regular follow-up and looked just a regular pinguiculitis, but it looked weird to me, too much vessels. I didn't like it. But the good thing is that, of course, if you don't have MS-39, you're not going to bring this patient to theater. You are going to follow up here. But with MS-39, you have the diagnosis in 1 minute. So what I did, I scanned the first pinguicula, the temporal pinguicula, and here you can see that this is normal because you can follow the corneal epithelium through towards the conjunctival epithelium. You can see that it's normal. It's homogeneous, there is no problem. But then you move to the nasal pinguicula and this is not normal. You can see the difference between a normal pinguicula and a not normal pinguicula, where the epithelium again is showing signs of ocular surface squamous neoplasia. This patient didn't want to go for topical chemotherapy, so he did an excisional biopsy to confirm the diagnosis. So what looked like a pinguiculitis, and without this device, you could have never done surgery. You would have dedicated follow-up. With MS-39, you have diagnosed cancer in 1 minute and heal the patient. So, on my view, the MS-39 is openly, actually, before for me, I don't have a specific clinical for ocular surface dysplasia and neoplasia, but since I have the MS-39, seriously, I'm diagnosing 1 case every 3-4 months. That for a regular case clinic that is not specialized on that is too big, but actually something that I'm sure we all have, and we're missing the majority of these phases. Thank you very much.